Okay, we've been at 7 for a little bit, so I'm going to turn off my camera and we are just going to get going. So guys, this is AHIP Study Hall Module 4. Um, I do want to warn everybody I'm off work on Monday, but I'm available Tuesday if you need my help for AHIP, but I am off work on Monday. So with that said, let's go. So new, straight out the bat, new for 2025 marketing rules. Compensation, and I copied this just so we can have it word for word through AHIP during this confusing time. Compensation to independent agents brokers will include amounts for administrative services. All plan sponsors that pay compensation to independent agents brokers must pay the specified fair market value amount. No additional payments may be made to independent agents brokers tied to enrollment, related to enrollment in Medicare or Part D plan or product, or for services conducted as part of the relationship associated with the enrollment. Okay, we're going to stop there because we've had some updates since I made the slide deck. So a lot of people put out lawsuits to CMS because what they are basically saying here is they're no longer going to give marketing money because of the $100 new to Medicare pay raise we got, 50 for plan to plan pay raise we got for 2025. That is supposed to offset the cost of like call recordings, administrative, things like that. So the carriers were like, then we can't do marketing money anymore because we're paying this extra stuff. So there was a lot of lawsuits to CMS, and I'm just at a very high level giving you this overview. Well, business has come back as to normal, as usual. So basically what they're saying now is the marketing before we would co-op so that you could do events and conduct business during the annual enrollment period and absorb the cost. So some carriers are going back to that, and other carriers are staying depending on, what you spend, they'll do a reimbursement. So there's a little bit of change, but not a lot. But originally they were supposed to take all that away, and we got $100 pay raise for new to Medicare, $50 plan to plan, and then a higher renewal. So that's the update on that. It won't be on the test, but that's just for your own information, and hopefully I didn't confuse you. Beneficiary information collected by a third-party marketing organization, including the agent broker, for a purpose of marketing or enrolling the beneficiary into Medicare Health Plan or Part D, may only be shared with another TPMO when prior written consent is given by the beneficiary. So basically, unless they sign something that says you can share their information to another agency, you cannot. The consent must list each entity receiving the data. I don't know about you all, but if I'm going to sell additional insurance, I'm going to sell it myself. Plan sponsors must ensure that no provisions of a contract with the agent or other TPMO has direct or indirect effect of creating an incentive that would reasonably be expected to inhibit an agent's ability to objectively assess and recommend which plan best fits the healthcare needs of a beneficiary. So all these rules that we're going through right now, all these changes, it's honestly because of all the outbound calling, switching beneficiaries plans, then they're shocked that they don't have the plan that they thought they had because it changed because they answered a call. All of this noise and racket is what has caused CMS to really look at the rules and the guidelines and make changes. So when you're wondering why we have so many changes this year, as far as marketing and all that, that is why. They're trying to really cut down and get it back to where agents aren't selling for a transactional sell. They're building client relationships and doing what's best for the client. So communications and marketing rules. Medicare marketing and communication rules apply to MA, MAPD, PDPs, cost plans, and MMPs. For MMPs, marketing requirements can vary by state. Plan marketing reps are subject to the same requirements related to marketing and communications as the plans. That is on the test. Plan marketing reps are subject to the same requirements related to marketing and communications as the plans. Plans are responsible for ensuring compliance with Medicare rules. That is also on the test, but it's asked very differently, and we'll cover that when we get to it. But there you go. Plan marketing reps are employees employed by the plan. Individuals, entities contracted with the plan through a direct or downstream contract. So what they're going to ask you on the test is, basically the answer is that agents, brokers, TPMOs, captive agents by the plan have to follow the same rules. Plan sponsors must contract with or employ marketing reps that are licensed by the state they conduct activities in. The question on the test reads that because somebody works in this call center, they don't have to be licensed in such and such state. The answer is yes, they do. If they are going to discuss any insurance or make sales in any state, they must be licensed in that state. Marketing reps must be appointed by the plan if required by state law. MA and PDPs are required by law to ensure that all employed and contracted marketing reps complete training at least annually, including content specified by CMS. That is on the test, that we have to take training at least annually and pass a written test. Oh, there's that bullet point. Reps must pass a written test each year with both Medicare and the products they are selling. Agents, brokers, marketing, employer, union group plans are not required to be tested. Plans may choose to require testing. That is on the test. What they're saying is that if agents and brokers who work for an employer union group, they do not have to be tested because they are sponsoring an employee plan or union plan. Plans offering employer or union group products are not required to submit marketing materials to CMS. However, CMS may require a review if employee complaints occur to ensure the plans adequately and accurately inform beneficiaries about their rights and obligations under the plan. That is on the final. If y'all want to take a picture of it with your phone. So that's one of those big awkward questions in the test. TPMOs are organizations and individuals, including independent agents and brokers, who are paid to perform lead generation, marketing, sales, and related functions as part of the enrollment chain. TPMOs may directly contract with the plan sponsor, a downstream contractor, or plan sponsor, or may be a related entity of the plan sponsor. You know, the first tier downstream and related entities, or FDRs. They may also be entities that are not FDRs but provide services to an MA plan or MA's FDR. There's not one question about that on the test like that. So it's just a big confusing paragraph. Agents and brokers employed by the plan are not TPMOs. They are marketing representatives. Those are people who actually work for the carrier. Communications are materials and activities that provide information to current and prospective enrollees on Medicare health plans and PDPs. Marketing is a subset of communications distinguished from communications-only material and actively based on intent and content. Marketing activities and materials are subject to higher degree of regulation and oversight. There is a question regarding marketing materials, but I don't think we're to the answer yet. This is it. Number one is on the test. The purpose of marketing activities and materials is to draw current enrollees and prospects' attention to a plan or group of plans and to influence beneficiaries to stay with or choose a new plan. That's on the test. Marketing content activities and materials include or address content regarding information about benefits, premiums, cost sharing, rankings, measurements and standards, plan rewards, mentioning a broad category of widely available benefits such as dental, vision, hearing, or premium reduction is marketing content. So the reason you need to know that is because if you go and do an educational event and you mention any of what's on the screen right now, you just turn that educational event into marketing. And if you didn't register it as a marketing event, you could get in trouble if you're being shot by CMS. To make sure you don't even speak broadly about dental, vision, hearing, premium reduction. Communication-only materials and activities provides information to current and prospective enrollees that contain no marketing content or include marketing content without marketing intent. For example, CMS designates certain material that have marketing content, such as the evidence of coverage in EOC, as communication-only material, while the SOB and the ANOC are marketing materials. So we all know the EOC has premium, it has benefits in it, but the summary of benefits, known as the SOB, also does. So I don't know why the EOC is considered material, communication material, while the SOB and the ANOC are marketing materials. Because ANOC is the annual notice of change, which everybody's going to be getting this year because everything's changing. Okay, a targeted letter to remind plan members to get preventative services they have yet to receive and list cost sharing for those services. While it contains marketing content, it does not meet the marketing intent standard. So what they're talking about there is get your mammogram for $0. You're due. That's not marketing, even though it discusses a benefit amount. Regulation of communications activities and materials. CMS does not generally require communications only material to be submitted to CMS for review and approved. It does require certain disclaimers to be used on those materials. CMS also prohibits the use of certain claims or language. Guys, for those that work at Medicare Compare USA, any of the materials we have are approved. They have the correct disclaimers and all of that. So if you are interested in any marketing materials, just get with me and I'll get you a crystal so we can figure that out together on which materials you like that we offer. CMS does require certain communications, EOCs, critical to beneficiaries' understanding and assessing benefits to be reviewed. CMS may require prior review of communication materials that, based on feedback such as complaints or data gathered through reviews, warrant additional oversight to ensure accuracy. Basically, if it's a communication, it's not going to talk about anything of value. And if it is marketing, it's obviously going to talk about benefits. Regulation and communications only contact. CMS regulates how reps can contact potential enrollees. CMS may require disclaimers or other information included on materials. They also prohibit certain claims and language. That's going to be like best, better than, the like, things that say an absolute statement that may or may not be true. Agents may not make cold calls even if the conversation is limited to communications content. Content. CMS regulates what reps may say to potential enrollees. They also have rules regarding marketing in a healthcare setting, which we'll go over in Module 5. CMS requires reps to comply with state licensing laws and place strict limits on marketing and healthcare providers. CMS also regulates when you can market the following year's plan, October 1st. CMS requires all marketing material to be submitted to CMS for approval and review. Materials used for employer and union groups do not have to be submitted. It repeats itself so much. Examples of marketing activities. So talking to beneficiaries how a specific plan offers higher coverage for benefits beneficiaries use most often. Handing out plan brochures and summary of benefits at an event is marketing. That educational event just turned into a marketing event. Call current clients to discuss upcoming premium and benefit changes to their plans and encourage them to remain enrolled. That is marketing. It's retention, but retention is marketing. I strongly encourage you, in October to have appointments scheduled with your existing book because the Inflation Reduction Act is going to change a variety of things. So there's nothing wrong with it being a marketing activity, just don't do it at an educational event. Passing out plan-specific benefits, information, and business cards after a seminar is marketing. Accepting enrollment forms and enrollments at a marketing event is marketing, and I hope you are doing that at a marketing event. That's why it's a marketing event. Social media posts that mention plan benefits and or star ratings is also marketing. Plans and their representatives may not mislead, confuse, or provide false information to beneficiaries. Target enrollees based on income levels, except for DSNPs. Target enrollees based on health status, except for chronic special needs plans. State or imply that plans are only available to seniors rather than all eligible Medicare beneficiaries, younger and disabled. I am the world's worst about referring to people coming into Medicare about calling them T65s, agents, and seniors, and I really need to be more aware of that. Marketing and communication prohibitions, unsolicited contacts. Marketing representatives are not to make unsolicited contact with beneficiaries, including through door-to-door, approaching beneficiaries in common areas such as parking lots, hallways, lobbies, sidewalks, stores, or parks. They have to come to you. Telephone calls without a scope of appointment or not meeting plan business exception. Texting or other forms of electronic direct messaging, including instant messaging, include social media platforms, voicemails, but you can email, snail mail is what I call it, and other print media like advertisements. You can do those things, but you can't do the ones above. Marketing reps may not make unsolicited calls about other business to generate Medicare plan leads. That's called bait and switch. Make unsolicited contact based on referrals by enrollees or other sources. You can leave your business card with beneficiaries to hand out. So what they're suggesting is that you can't sit down at a table and enroll somebody and ask for their friend's phone number, but you can leave your business card. Enrollees who voluntarily disenroll from a plan may not be contacted for sales purposes or even asked to consent to sales tactics. So if you notice that somebody voluntarily disenrolled from a plan and went to a different plan, you cannot call them and ask them why and say that they were in a better plan. Make calls to beneficiaries voluntarily disenrolling for sale purposes or be asked. Oh, wait, I just said that one. Cannot call beneficiaries who attended a seminar without consent to contact. You also can't require them to leave their information in order to attend a seminar. May not contact a lead provided by another TPMO unless written consent by the beneficiary is given. They repeat that at least 10 times through here. Marketing reps may initiate contact through email. You must provide an opt-out option. Return calls or messages to those who initiate contact. Call those who filled out a business reply card or asking a plan customer care rep to have an agent contact them. Call to confirm appointments that have already been scheduled. Call beneficiaries who have submitted enrollment applications to conduct business related to the enrollment. I hope we're all doing those things. You may also call your current members of a parent organization, including non-Medicare health plan products, to discuss health plan business. So if you have people say that they have Blue Cross Blue Shield at work, Blue Cross can call them and talk to them about Medicare business. Agents who already, there we go with my agents, who already enrolled on the GHP are aging in, which GHP is group health plan, and are aging into Medicare. Current MA enrollees to promote other Medicare plan types or to discuss options and benefits. Contact MA organizations and Medigap enrollees regarding MA, PDP, or cost plan options. You can call current members of a plan to discuss and inform them about general plan information such as AEP dates, flu shots. That's the answer on the test that yes, you can contact them about flu shots, plan changes, educational events, or other important plan information. When placing these calls, you must offer the ability to opt out of future calls. Marketing and sales events are designed to steer potential enrollees towards a plan or to remain in their current plan. Did I just say educational? I meant marketing and sales events are designed to steer potential enrollees toward a plan or to remain in their current plan. Advertising and invitations in any form of media used to invite beneficiaries to a marketing meeting or educational event must include, for accommodations of persons with special needs at meetings, call and insert phone number and TTY number there. That is not on the test. Educational events are designed to inform potential enrollees about Medicare, MA, Part D, and other Medicare programs without marketing materials or activities. That is on the test. Educational events may be held in public venues and put on by providers or other groups sponsored by one or more health plans. Marketing events are prohibited from occurring within 12 hours of an educational event in the same location. The same location is defined as the whole building and the adjacent buildings. That is new. It's not on the test, but this right here, whoops, I'm sorry. I didn't mean to do that. But this part right here is new. And I guarantee that came about last year that people were going to the building next door or to a coffee shop next door to do an enrollment after an educational event. So nope, you can't do that. You have to wait a full 12 hours. Medicare communications and marketing rules, sales events. Plans must submit presentations to CMS that include marketing content before use at an event. That is on the test. At marketing and sales events, agents may discuss plan-specific information, including premiums and benefits, star ratings, merits of a plan, distribute and collect applications, distribute plan-specific advertisements, and general information about Medicare, and provide refreshments and light snacks. Agents may not require beneficiaries to provide contact information, including email, as a condition to RSVP for an event online or through the mail. Sign-in sheets must be labeled as optional. Conduct health screenings or other activities that indicate cherry picking. That is on the test. It's going to ask if you can do a presentation at an event where somebody is getting their blood pressure or blood sugar, one of the two, taken. The answer is no. Provide meals or multiple snacks, refreshments bundled and provided as a meal regardless of value. You cannot do that. Use information collected for raffles and drawings for other purposes. Agents may engage in communication activities and distribute communication materials. Use a banner with the plan sponsor's name or logo, toll-free number, and website. The banner must be free of marketing content. So, like, I guess it could say Medicare Compare USA and have your phone number on it. Distribute promotional items, including those with the logo. I made sure to add that in here. That was not on there last year. You can also have a toll-free number and or website. These must be free of marketing content and consistent with the gift rules under $15 retail value. I want y'all to notice, it's always been that we can give non-normal gifts under $15, but I sure did get that question wrong, and the answer, I promise you, is $5 Starbucks gift card on this module test. I answered $15. It was wrong. Provide an objective presentation to educate beneficiaries on how they can get their Medicare benefits. Have a healthcare provider make an educational presentation on wellness or other healthcare related topics. Answer beneficiary initiated questions about Medicare health or drug plans. You can't bring it up, but they can. I mean, at that point, I would say I would love for you to fill out this consent to contact so we can schedule an appointment to answer all your questions in private. That's what I would do just to be safe, because I was shocked by this, because it's an educational event and you're not supposed to do that. But whatever, it was an AHIP. You may provide gifts, prizes, or promotional items to beneficiaries as part of an event or marketing purposes, regardless of enrollment and without discrimination. One or more gift is offered. On one occasion, combined value may not exceed $15. Multiple gifts given to a beneficiary on different occasions may not exceed $75 per year per person. That is on the test. So the answers on this Module 4 test are, make sure you click the one for the $5 Starbucks gift card, and when this one comes up, $75 per year per person. Gifts or prizes may not be in the form of cash or cash equivalent or other monetary rewards or rebates, even if they are less than $15 and do not exceed $75 annually. Cash equivalents include gift certificates or gift cards that can be converted into cash. General gift cards that are not restricted to specific retail chains or specific items and categories such as Visa gift cards are not allowed. Gift cards for retailers or online vendors that sell a wide variety of products such as Walmart or Amazon are not allowed. Debit cards are not allowed. Gift cards that can be used, here's that Starbucks gift card, or Shell gas stations are the examples they gave. Rebates include a discount on first month's premium or copay. You cannot do that. Gifts or prizes may not be charitable contributions. During an individual appointment, reps may market only health care related products. Identification on the scope of appointment. Products include Medicare health plans, Medigap, dental, but not accident-only plans, and annuities and life insurance. So you cannot discuss those. Non-healthcare products cannot be marketed during a Medicare health or drug plan appointment. If a beneficiary requests information regarding a different plan type, you need a new scope of appointment. So the question on the test says that you're there for an MA presentation, Medicare Part C, and the beneficiary inquires about a Part C plan. You would need to get a new scope of appointment sign, or a Part D plan to discuss the Part D before you discuss it. 48 hours before any marketing appointment, you must get a scope of appointment, and reps must coordinate the types of products that will be discussed: MA, PDP, cost, Medicare, Medicaid plans. The two exceptions are the last 4 days of an election period, so you do not have the 48 rule at the end of AEP or OEP, or unscheduled in-person meeting initiated by the beneficiary. So most commonly, this is when somebody comes up to you when you're working a retail table. That is somebody coming up to you. Somebody calling you on your phone because they got your number. That was unsolicited. You schedule an appointment. I guess phone isn't a good one because it says in person. Somebody, if you have an office and you have an appointment with somebody and his neighbor decides to join in and ask questions, so get a scope of appointment sign and you can continue on in the meeting. You do not have to wait the 48 hours if the person shows up in front of you. Scope of appointments may be in writing, including electronic signatures by the beneficiary or a recorded oral agreement. For appointments made over the phone, documentation is generally in the recording of the call. However, the agent may obtain a written scope of appointment signed by the beneficiary or authorized representative. This must be done before conducting the appointment. Plan sponsor may not agree to the scope of appointment on behalf of the beneficiary. So that means that the plan can't sign a scope for them, for the beneficiary. Social media. Plans and Part D sponsors must submit to CMS all social media and QR code posts that meet the definition of marketing materials. That's all it talks about for the social media on the test, is that first sentence right there. specifically those that include benefits, premium, cost sharing, or star ratings. This includes posts made by the agents. Social media posts are subject to marketing communications content requirements. Reposts are considered a product endorsement testimonial and must adhere to guidance on testimonials. I think the question discuss materials on social media and reposts or retweets must be approved by CMS, I think is how the question is. Compliance required practices. Marketing activities. Provide prospective enrollees only CMS approved and submitted or CMS created marketing materials. Use only CMS approved submitted talking points and presentations if they are marketing. Ensure that CMS's required questions and topics regarding the beneficiary needs in a health plan are fully discussed. In Module 5, they have really changed what we have to go over in an appointment, and it has to be recorded when it's over the phone, and they're looking for this. You'll learn about that tomorrow. Providers in the plan networks, prescription drug costs, costs of healthcare services, premiums, benefits, and specific healthcare needs. That's just a little sneak into tomorrow. That's not on the test till Module 5. Marketing and non-health related activities. Plans and Part D sponsors must obtain HIPAA compliant authorization from enrollees to market non-health related items such as accident-only life or annuities. HIPAA authorizations must specify that the plan Part D sponsor may use the individual's information for marketing purposes. Marketing reps are business associates of the health plans and that they sell. They must comply with federal and state law regarding the confidentiality of individual identifiable health information known as PHI, which includes any information about the individual's healthcare coverage, payment, or health conditions. HIPAA regulates both the use of disclosure of PHI. Reps may only disclose PHI on behalf of the plans they represent. There's going to be a question about, can you save it on a hard drive and take it home? I think the answer is no. Don't select that one. If a rep subcontracts with another individual or entity that may obtain, use, or disclose PHI on their behalf, they must enter into a business agreement with the individuals or entity requiring the same protection to the PHI. There's very little about that on the test. So here's the new required practices. That started October 1st, 2024. Beneficiary information collected by TPMO for marketing or enrolling them into MA costs or Part D plan may only be shared with another TPMO with written consent. We already went over that. The beneficiary's prior written consent must be obtained through a clear and conspicuous disclosure that lists each entity that would receive the data and allows the beneficiary to consent or reject the to the sharing of their data with each individual TPO. I just don't understand. Can somebody enlighten me why you would share information with another TPMO? No? Okay. The following requirements apply to marketing plans for 2023 and beyond. Independent agents and brokers and the other third-party marketing organizations must use the TPMO marketing disclaimer unless the TPMO sells all commercially available MA and Part D plans in a given service area. We all know this. We have to say it within the first minute of the call. We've known this for, I think, will be the second or third AP. The disclaimer must be verbally conveyed within the first minute of the sales call, electronically conveyed when emailing, online chat, or all other electronic communications, prominently displayed on TPMO website, included in any marketing materials, including print and television. Access and use of certain plan materials. Plans are required to post on their website certain downloadable documents. That will be your EOC, your your evidence of coverage, summary of benefits, ANOC, provider directory, pharmacy directory, and formulary. Such documents are important tools used by marketing reps to determine beneficiaries' pharmacy as a network, drugs are on formulary, benefits important to the beneficiary, and whether a plan covers out of network. TPMOs conducting lead generation activities directly or indirectly for a plan sponsor must, when applicable, disclose that their information will be provided to a licensed agent for future contact. Verbally when communicating by telephone, in writing when communicating through mail or other paper, or electronically when communicating through email, online chat, or all other electronic messaging. If the lead generating TPMO transfers a beneficiary to an agent, it must disclose to the beneficiary that the beneficiary is being transferred to a licensed agent who can enroll them into a new plan. Anyone who obtains leads from such entities must ensure all requirements have been met in generating leads and include the obligation in any contracts. So basically right here, what they're saying is that if you do lead generation from another TPMO, that might be, I don't know, Game Changer Leads or whoever, you're responsible to make sure that that has all been said, that you can enroll them into a plan if you're on warm transfers. Accessing and using plan materials, plans are required to post specific documents in downloadable format. This is on the test. Both beneficiaries and reps may access the following through each plan's website. We just went over that. Required materials with an enrollment form. When a beneficiary is provided with enrollment instructions form, they must also receive a pre-enrollment checklist, plans ratings, summary of benefits, and multi-language insert, or at plan option after September 30th, 2024, the notice of availability. So that's going to be brand new for this year. For DSNP, if Medicaid benefits are not included in the summary of benefits, a separate document containing them must accompany the enrollment form. If the beneficiary enrolls online, the plan sponsor must make these materials available electronically to potential enrollee before the completion and submission. For telephonic enrollments, the prospect must review the contents of the pre-enrollment checklist before completing the enrollment. In addition, the beneficiary must be told verbally where the summary of benefits and star ratings may be accessed on the website. Star ratings are released by CMS, allow beneficiaries to compare MA and Part D plans. These ratings include whether members got various screenings, vaccines, and other checkups to help them stay healthy, and how members rate the plan, such as access to care and customer service. It can be found at medicare.gov. Star ratings information documents must be posted on each plan's website. New plans and Part D sponsors do not have a star rating information and not required to provide it until the next year. So because when there's a new plan or Part D, they don't have the history to get rated on. So it would be the next year. Plan sponsors and reps may only mention the plan's rating in conjunction with the plan's overall performance. That is on the test. The overall performance. So just remember that. It can't be like they're great at customer service, but they got a 4 on something else. You can't say that it's a 5-star plan. Plan sponsors and reps may only market star ratings in the service area in which it is applicable. So if Humana has 5 stars in Omaha, but only has 2 stars in Washington, you can't be in Washington saying that Humana is a 5-star plan. And I just made all that up. I was just using it as an example. Plan sponsors and reps may not use plan star ratings in an individual category or measure it to imply a higher overall plan rating than is actually the case. Use star ratings in a manner that misleads beneficiaries to enroll into a plan. Use updated star ratings until CMS releases it on Medicare Pathfinder, and continue to use an old star rating after 21 days. This is on the test. Remember, 21 days from release of new ratings. So that's why a lot of us that get materials from the plans, we also get those paper things to put in there with the new star ratings, because most plans print their materials before the new star ratings are released. That's why they do that and mail those to you. You have to record your calls to completion from the beginning to the end, all enrollment. Marketing reps may not cross-sell, market non-healthcare related products during any MA PDP sales activity or other marketing activity for existing clients. Schedule a separate appointment for that. I love telling people in my provider channel that when somebody's turning 65, we try to get in front of them 6 months before their 65th birthday. And there's a lot of like hospital indemnity policies and things like that, ancillary products that are guaranteed issue up to age 67, including cancer. So that's a good time before you're even talking about Medicare Advantage or prescription drug plan coverage. If you know which way they're swaying and they might need a hospital indemnity or what have you, it's a great way to capture them as a client before they're even 65, and then you don't have to worry about cross-selling when you're in there to make the sale. State plan sponsors will not disenroll due to failure to pay. No logos or co-branding unless all material use the disclaimer other providers are available in the network. That is brand new this year. Fail to record all sales and enrollment related telephonic contact. I think this year, guys, because last year they did a spot check, at random to get recordings from agents. And the year before that, they kind of just left us alone a little bit unless there was a complaint. I think this year they're going to be asking for recordings. So make sure you're recording all of your sales and enrollment related calls. Change beneficiaries marketing fees, or charge beneficiaries marketing fees. You see this a lot on Facebook. There's a certain group, I'm not going to say their name, but they have talked about how they have charged fees to beneficiaries to discuss with them, their options. You cannot do that. That's illegal. Engage in bait and switch, such as unsolicited outbound calls. Do not use unsubstantiated superlatives, however you say that, best, highest, and rated. Do not use the word free to describe $0 amounts. So you can't say it's free. I don't know why you wouldn't use it. You get a free Fitbit when you join this plan. You can't say that. Or you can see your PCP for free. Nope, you have to say $0. OEP is when someone who is enrolled in an MA or MAPD plan can make a one-time change into a new MA plan or elect to go to original Medicare. Those who enroll in an MA plan, January 1st, MA OEP is the first 3 months, and we'll discuss that more in Module 5. It goes into great detail with OEP. I didn't see any changes this year, so it's the same old, same old. During OEP, reps may not send unsolicited materials advertising the opportunity to make an additional enrollment change or reference the OEP, engage in or promote activities that intend to target the OEP as an opportunity to make further sales, contact former enrollees who selected a new plan during the AEP. So no, you can't call them during OEP because you lost a client and roll them back into you in the OEP into a different plan, unless they contact you to go back to the plan they were disenrolled from. Target beneficiaries who are in OEP because they chose a MA or MAPD plan during AEP by purchasing a mailing list or other means of identification. During OEP, reps may conduct marketing activities focused on other enrollments such as T65, 5-star plans, D-SNP, C-SNP, And MAOs may also include information about OEP on their website. That's the big people. Marketing healthcare setting. Reps may not engage in marketing in areas patients receive healthcare services, such as exam rooms. The question on the test is, if you're in a pharmacy and you set up your table, where do you have to accept completed enrollment forms? And it's just going to be in the common areas. Reps may provide communication materials to be distributed and displayed in the healthcare setting, conduct sales presentations, and distribute and accept enrollments in common areas such as cafeteria, community rooms, entryways, waiting rooms, or conference rooms. I just had a talk with one of our hospital systems, and we're doing in-person orientations, and that's exactly where I told them we could do them. Marketing in long-term care facility includes nursing homes, assisted living, and board and care homes. I still to this day don't know what a board and care home is. Does anybody know what a board and care home is?
Never heard of it.
Me either. Plan sponsors and reps may schedule an appointment at the beneficiary authorized individual's request who is in a long-term care facility. Basically, when it comes to long-term care, you can set up a table, they can approach you, you can't go to their rooms, and you cannot give enrollment forms to the management because they cannot collect them on your behalf or scope of appointments. Plan oversight and enforcement. Plan sponsors must establish and implement an oversight plan to monitor agent activities, identify non-compliance, and reporting to CMS. That first sentence is on the test. Plan sponsors are responsible for ensuring compliance with CMS marketing regulations and guidance, including monitoring and overseeing activities of their third-party marketing organization, marketing reps, and providers. Plans are required to implement strategies to prevent prohibited marketing practices from occurring. My brain goes faster than my mouth. Detect prohibited marketing tactics in early stages, and take immediate corrective action in response to non-compliant marketing activities, such as disciplinary actions are withholding or withdrawing commissions, retraining, suspension of marketing, termination, and other consequences set in the plan's contract. So on this screen right here, this is on the test, the first bullet point, and then there's a question, and this is the answer. All 5 of these. So you need to know that. Whoops, I'm sorry for those who are trying to take a picture of it, and that. The part, business as usual. Plans must comply with requests from a state insurance or other departments in connection with investigations of plan reps who are licensed by the department. Plans, and that is on the test, you must comply. Plans must comply. Plans must report to the state any terminations of an agent or a broker. Everybody just take a picture of the screen because this is on the test in various spots. Plans must report to the state any terminations of an agent or a broker, including the reason. Plans must also report to CMS any for-cause terminations. Report to CMS all enrollments made by an unlicensed agent. Upon request to CMS, plans must provide information necessary to conduct an oversight of marketing activities. All of that is in the Module 4 test or the final exam. Every one of those bullet points. Plan sponsors must require TPMOs, including independent agents and brokers, to disclose plan sponsor any subcontracted relationships used for marketing, lead generation, and enrollments. Report to plan sponsors monthly any staff disciplinary actions or violations of any requirements that apply to the plan sponsor associated with beneficiary interaction to the plan. I don't recall any of that being on the test, but so here we go, guys. Ears up. New for 2025. prohibition on incentives beginning 2025. Plan sponsors must ensure that no provisions of a contract with an agent, broker, or TPMO have a direct or indirect incentive that would inhibit their ability to objectively assess and recommend which plan best fits a beneficiary's healthcare needs. So what they're saying there is everybody has to remain objective. You just have to be in the middle and go with the plan that best supports the beneficiary and not our pocketbooks. So we cannot be incentivized to sell Humana over UHC or UHC over Humana. This obligation applies not only to direct contracts, but also to contracts between third-party marketing organizations. Sponsors and their subcontractors may pay individuals or entities referrals for potential enrollments into a plan, 100 for MAPD or cost plans, $25 for PDP. I don't know how you're going to recoup that $25 if you're paying for PDP, because the rumor mill is that a lot of the PDPs are non-commissionable next year. But we'll see. We'll see. Don't listen to me. Compensation defined. Compensation is defined as commissions, bonuses, gifts, prizes, and awards. And beginning in 2025, payment of fees, training, certifications, and testing costs are now considered compensation. Reimbursement for mileage is now compensation. Reimbursement for actual costs associated with sales appointments, such as venue rent, snacks, and materials, are now defined as compensation. Any other payment made to an agent or broker tied to an enrollment related to an enrollment is now all compensation. I'm going to sit here in case y'all want to take a picture with your phone. Plan sponsors may not pay agents who have not been tested and trained. If an agent is terminated, the contract will govern future payments. However, agents must remain trained, tested, licensed, and appointed to continue receiving renewals regardless of activity of selling. So what they're saying here is now, whether you're selling or not, you still have to go through all the training, all the appointments, and keep your license going to receive those renewals. And I have a lot of questions about that, so you're going to hear a lot about that through me this year. Plan sponsors are not required to pay compensation for enrollments. However, if they do, beginning in 2025, compensation for initial year enrollments must be fair market value published annually by CMS. Compensation for renewals must be 50% of the FMV cutoff. So what they're saying is that everybody has to pay the same. Like United Healthcare can't pay you more than Humana, so everything is the same, but they can choose not to pay us if they would like, but they're going to. On the MA side, it's $700. I hope we get to it soon because I haven't got it memorized yet. But again, here's the referral. Fees paid to independent, captive, or employed agents, brokers may not exceed $25 for PDP or $100 for all other plans. Compensation is prorated for mid-year enrollments. The compensation amounts include payment for administrative services. Agents may not receive additional compensation for such services. Extra $100 is to help with all that. If a beneficiary disenrolls within the first 3 months, the entire comp amount paid must be recouped. Some exceptions apply. Those enrollments done at the end of the year, if somebody becomes dual, if they become qualified for special needs plans, LIS, moved in or out of an institution, death, plan termination. Those are the exceptions. Whoops. And that is the end of Module 4.